Thank you for joining us today, Angela. Before we get started, would you mind just introducing yourself a little bit and telling us a little bit about yourself?
Yeah, I'm Angela. I worked a year and a half on ortho neuro. I worked 4.5 years on neurospine, and I just recently started at Claire's house.
All right, we'll get started then. What is your definition of a professional relationship?
It's a relationship in a work setting in which personal boundaries are established and maintained.
And how do you personally maintain a professional relationship with physicians, other nurses, patients, and subordinates?
I hate the word subordinates. You never have a good working relationship with them if that is not how you view them. Treat people with respect, and you will be amazed how teamwork will improve.
And how do you set personal issues aside in order to maintain professional at work, especially when you're having an off day?
Push them into the back of your mind and focus on the task at hand.
Has there been a time when an ethical issue has occurred and you have been uncertain as to how to maintain a professional relationship? If so, how did you handle the situation? For example, has a patient ever asked for your phone number?
That's never happened to me, no.
Okay. How about, have you ever dated a coworker?
That either.
All right. Who can you go to when a professional boundary has been crossed?
If you are unable to solve it on your own or don't feel comfortable doing so, you can always contact your director, supervisor, or your charge nurse and discuss the issue with them.
And when dealing with a difficult staff member or a patient, how do you maintain a professional relationship with that individual? For example, have you ever disagreed with a physician's treatment plan?
Yes, many times, but only address the issue if I felt that a safety or ethical concern. Example would be when one of my anterior cervical spine fusion patients was having difficulty swallowing and coughing with intake. I requested a speech swallow evaluation from the surgeon. He refused and stated that he's fine and speech enjoys putting feeding tubes down people too often anyways. I took my concerns to the hospitalist internist and they deferred to the surgeon and wouldn't get involved. So I talked to my manager and she told me to call our house MD, so I did. The next day I came back and he had a feeding tube in due to dysphagia.
Have you ever had to work with a staff member that slacks off at work or causing you a larger workload?
Yes, many times. I just tried to huddle in the beginning of my shift and let them know my expectations and follow up with them frequently throughout the day and ensure that you are holding them accountable for their duties and job requirements.
Have you ever had to care for a patient that was upset, inappropriate, or non-compliant?
Frequently. The best thing is to always validate their concerns so that they feel like they are being heard when they have complaints. If they're inappropriate, just be sure to set clear boundaries and acceptable behavior. If they're non-compliant, it can't really be fixed. You can't force them to act a certain way. All you can do is educate and encourage.
Have you worked under a nurse from hell?
Yes, sometimes. Just be sure to set limits and be straightforward with those types of personalities. Typically, I have found that people who aren't the nicest or have strong personalities expect others to be timid around them. Make sure you set limits and don't allow yourself to be bullied or taken advantage of.
How do you handle an ethical issue such as racial discrimination in a professional manner?
There have been a few times when I had an elderly patient who didn't respond well to the PCAs that were minorities and had thick accents. They made some inappropriate racist comments, and I was straightforward with them, but it was unacceptable and inappropriate, and we don't tolerate those types of comments. It didn't happen again. Be careful with the type of person you say that to, though. It could go a different way. Always feel out the person and how you think they will respond.
How do you handle sexual harassment in a professional manner?
Tell the person that their comments and actions were inappropriate. If you feel uncomfortable, and let your supervisor know if you think the incident needs to be reported.
How do you handle different cultural and linguistic barriers in a professional manner?
The best way is to be open so that people of different cultural backgrounds feel that they can come to you with concerns and be approachable.
Have you experienced conflict with the demands of an institution in which you are employed versus the primary obligation to the patient? For example, have you experienced issues with being short-staffed?
Yes, unfortunately, you have to suck it up and take care of the patients because they are your primary concern. You can fill out a safe staffing report and talk to the management.
How about experience with reduction in quality of nursing care due to institution decisions?
Yes, due to budget cuts, ratio for nurse to patient and nurse to PCA has increased. Some duties that were usually the PCA's role have been slowly being transferred to the nurse, which has made it much busier, and in turn feel very unsafe because you are doing more cares and taking time away from assessing labs and other coordination of care.
Have you witnessed or heard about a conflict of loyalty among nurses? Like a nurse covering up for another nurse with illicit drug use, nurse that might cover up the coworker's incompetent practice, or other actions that have the potential to harm a patient?
No, not that I can remember or think of.
Can you explain a situation when someone has had to make an urgent life-saving decision that went against the physician's orders?
I can't think of one. Usually would never get to that point if I felt it was necessary.
All right. Describe experience that you've seen or heard about in which nurses experience bullying or lateral violence.
I don't have any. I don't know.
Okay, that's fine. And have you witnessed or heard about physicians treating nurses with an old traditional view, much like gender roles in society? Like the nurse hesitates to disagree with a physician even if there was a good reason to do so because the physician is to be obeyed?
There is definitely a barrier for some physicians, but you need to remember that you are the advocate for the patient, and if you truly have a concern, you need to speak up. It is hard at first, but eventually you will get over it and you will let it roll off your shoulder.
Is there any other advice you have for us as nursing students related to professional relationships?
Be respectful, have an open communication, and be assertive when you need to. Remember, you're the patient's advocate.
Thank you.